Welcome to today's Health and Wellness Thursday. I'm Rebecca Crane-Okada, and I'm happy to be the host along with Alston Novak, who is our facilitator. Uh, Today's topic is navigating the journey of hair loss with the CPR method. And I'll introduce our speaker in a moment. I do want to acknowledge the Ken Johnson family, who, in memory of Joan Brierton Johnson, support much of the patient education we have for our program here. So as I mentioned, I'm Rebecca Crane-Okada. I'm a nurse and the program manager for our clinical services here. And Alston Novak is our administrative assistant. And our guest speaker today is Hibachi Abbas. I'm thrilled that she's here with us today representing Hair with a Cause, Oncology, Aesthetic, and Wellness. Hiba and I met recently, although I had met Deborah McDowell in 2017 when she was here for a mammogram, and we just started talking, and she told me about her dream to help women who are losing hair as a result of chemotherapy. And that program has now expanded, and Hiba is their head of operations. So we are thrilled to have you here today, Hiba, representing the group, and
Thank you.
take it away from here.
Thank you. Hello, everyone. And thank you, Rebecca, for the kind introduction. Um, it's been a long journey from when we first initially, Rebecca met Deborah to where we are today. So we are humbled and in gratitude to you all for giving us opportunity and space to learn a little bit more about how we can navigate hair loss and what we do. So a little bit about us is we're located in Los Angeles, California. Hair with a Cause was founded in 2017. And then we recently rebranded to Oncology, Aesthetics, and Wellness in 2021. We are an all-inclusive center for women offering services and products that address the critical unmet need and appearance-related side effects caused by chemotherapy. So mostly adverse effects caused by chemo, and we have various pillars that we touch upon and specialize in. But today we're going to be talking about our hair with a cause pillar more specifically. So how to navigate the hair loss journey. How we look at it here at Hair with a Cause is that there are three various stages. Upon diagnosis, which is stage 1, during chemotherapy, stage 2, and then after chemotherapy, stage 3. So today we will look at each particular stage in more depth and detail and what services and products or how we can really take care of our hair and address it throughout those 3 different stages. Upon diagnosis. So upon diagnosis, we often find that a lot of our clients and patients are very overwhelmed by the diagnosis, the treatment plan. Everything happens very quickly. So once a treatment plan is determined by your healthcare providers, it's best to understand what the hair thinning will look like. And to ask the right and necessary questions if you're going to be undergoing chemotherapy. To what extent are you going to have hair thinning? Will it constitute as hair loss? Or if you are not going through the chemotherapy route, will you experience any kind of hair thinning? Once it's determined what your treatment plan is, it would be best for us and helpful to us in helping you navigate which treatment plan is most suitable for you throughout your journey. We have 2 hair preservation options in which we look at upon diagnosis. We have created a treatment that is called our CPR treatment, which is cut, preserve, and reattach. Upon diagnosis, if your treatment plan is set that you're going to be completing chemotherapy rounds, we advise that you cut your hair upon diagnosis, preserve it during your chemotherapy sessions, and then once you've completed treatment, we take that same hair and reattach it to your new growth, which occurs about 4 to 6 weeks after your final cycle. Or an alternative hair preservation option is making a wig out of your own hair. So upon diagnosis, we also have the option of cutting your hair and taking that same hair and turning it into a wig. Our turnaround time for that typically looks anywhere around between 2 to 4 weeks, and it gives you yourself your sense of self while you're going through treatment, while being able to make use out of your own hair.
Can you speak to the pictures here?
Absolutely. So
what's happening in the pictures?
in the pictures, thank you, Becky, for touching on that. On the left-hand side, you see the black and white images, which is step 1, which is the cut. Step 2, in the middle, the hair is preserved, stored away securely. And then step 3 is reattached. So once you've completed treatment and have just an inch of growth, we take that same hair that was preserved and we reattach it. And then on the far right, that is a client that actually cut her hair prior to treatment, preserved it, and then reattached, and we reattached it for her once she completed treatment. She actually waited a period of about 9 months after chemotherapy treatment because she did have more health complications, but for that reason, we had to wait a little bit longer, but typically it's just done with just an inch of growth. During chemotherapy. Now, there isn't much that Hair with a Cause essentially recommends while you're going through treatment in terms of hair beautification or any services that we can provide, but our overall experience with our clients is excuse me, gentle scalp care while you're going through treatment is of utmost importance to ensure that you are using fragrance-free shampoos and conditioning bars. Any fragrances to the scalp can cause some irritation, and that can also inhibit hair growth post-chemotherapy. Using a satin pillowcase as your hair continues to shed, allowing your hair to shed throughout the cycles of chemotherapy. Using a satin pillowcase can help with alleviating from any knotting that may occur as the hair continues to shed throughout each cycle. And then using a breathable, lightweight cap and head covering. If you opt to not wear a wig while you're going through treatment, which a lot of our clients do not, using a very breathable and lightweight cap will allow your hair and your scalp to retain the moisture that it needs while you're going through treatment because of how dry and brittle the skin may get due to the side effects of chemotherapy. Some of our clients do opt to wear a wig, and there's various options of wigs in which we offer and we recommend to our clients. There are 4 different types of wigs. There is a synthetic wig, a hybrid wig, a real human hair wig, and a wig made out of your own real human hair. Hair with a Cause specializes in more customized pieces. So in our wig consultations, we walk our clients through the different and educate them on the different types of wigs that we offer, as well as take their custom sizing and measurements and create custom wigs for our clients. Synthetic, unfortunately, we do not offer any synthetic pieces, but we do have spaces that we recommend in the local LA region as well as on a national scale. But Hair with a Cause specializes in hybrid and real human hair wigs and making a wig out of your own hair. Hybrid wigs are a blend of synthetic and real human hair. The wigs look very natural, very lightweight, and it's a good wig. It'll get you through treatment and it will serve the purpose that it needs to serve. I always recommend a hybrid wig for our clients that are on a shorter chemotherapy plan, and their regimen looks a little bit like anywhere between 3 months or less. But for our clients that are on a longer treatment plan and are going to be wearing the wig on a more frequent basis and need something that looks a lot more natural and more lightweight while they're going through treatment, then we would recommend a real human hair wig. The real human hair wigs that we create are custom to measurements, length, color, and all the specifications that you would like in your wig. You pretty much get to handpick the type of wig that you would like and work closely with our hair specialist to make that wig and have that created for you within about 2 weeks. And the third option is making a wig out of your own hair. Obviously, there is a little bit of a lag time between when we cut the hair and then the wig is made, but that lag time looks about anywhere between about 10 days to 2 weeks. In that time between, we always recommend that our clients, either if they're comfortable wearing their natural hair, or if not, we provide them with a piece that they can take away home while they wait for their piece to be made. But this allows our clients to make use out of their own hair without allowing it to shed. And one of our clients recently described this best. She said that consciously cutting your hair and making a wig out of it or preserving it for chemotherapy, it becomes a beautiful experience because you're consciously allowing yourself to let go of it and create something out of it that can best serve you while you're going through this journey. And that really resonated with me because how overwhelming everything and quickly everything occurs upon diagnosis. Having a treatment plan, an action plan, is what we specialize in and alleviate the stresses of what to do with hair and how to navigate what the hair loss, hair thinning may look like, and having a treatment plan and action plan with us will kind of alleviate a lot of those stresses. Upon completion of chemotherapy, we recommend our hair specialists take a look at the hair. And we have clients who have done cold capping, have tried to preserve their hair through cold capping. We've had clients who just allow their hair to naturally shed. We've had clients who just have experienced some hair thinning, so have retained some amount of density. But in terms of hair coloring, it's very subjective and there's not one set rule. Typically, the recommendation is just avoid color for 6 months. But we've actually found that it's not realistic for a lot of clients. They just are ready. Once they finish treatment, they are ready to book on the shelf, move forward, and kind of go back to some kind of normalcy. And a big part of that is how our hair looks. So when looking at hair color, our recommendation is always to wait 8 to 10 weeks upon completion of your final cycle, which is 2 weeks after your last chemotherapy. Waiting that 8 to 10 weeks, but we to deposit any color, so dark, making the hair darker, or coloring any grays. What we recommend is to avoid bleaching completely. So if you want to lift your hair, to avoid that for the entire 6 months. But for some instance, if our clients have done cold capping and their hair is more brittle or more fragile, then we would recommend waiting a little bit longer than the 8 to 10 weeks. So like I said, there's not one set rule, but it's very important that you talk to your healthcare providers as well as a hair specialist and better determining if your hair is ready or safe for color. Yeah. And then once you're finished with chemotherapy, what we typically see is hair growth begins about 2 weeks after your final cycle, so 4 weeks from your last session. And what that looks like is a peak of hair growth, and over about the 6-month period, you should have anywhere between 2 to 6 inches of growth. That's what we typically and generally see. In order to promote healthy hair growth, we recommend good nourishment, so making sure that you're intaking a healthy diet. Natural oils, Jamaican black castor oil is a great option for hair growth, as well as coconut oil and olive oil. So using those natural oils on a weekly basis and just doing a hot oil treatment will help speed up hair growth, as well as just gentle care and being mindful that it is a process and that it will take its time. And throughout that process, just being patient with your body and allowing the hair growth process to roll out the way it does. And for some clients, it could take months, and for some other patients, it could take a couple weeks. So it's very subjective from one person to the next. After chemotherapy, the service that we offer is post-chemotherapy extension strands, and that is what we are most known for. That is where we first started in 2017, is the post-chemo extensions. Post-chemo extensions, we take a look at our clients' hair pre-chemotherapy, as well as pictures of their hair while they're going through treatment, and then pictures of their hair upon completion of treatment. Some of our clients don't hear about us until after they finished chemotherapy treatment. And what we typically do is we source 100% real human hair, so that we pretty much mimic that exact same look that clients had prior to starting chemotherapy treatment. We take that hair, we turn it into extension strands, and once you have an inch of regrowth upon completion of treatment, we have the client come in and a service is performed in which the hair is reattached to that new growth. And this serves as a seamless transition as the hair continues to grow out for a period of about a year. At first, that first stage is like a pixie cut, and then after that is like the mullet phase, and then it's like the bob phase. So throughout those 3 different stages, it's like navigating how to style the hair, and like, just kind of going back to wanting to quickly go back to what you look like pre-chemo, but hair takes the longest to grow back. So those extensions serve as a seamless transition back to self. With the extensions, you have free range to put your hair up in a ponytail, go swimming, work out, really go back to day-to-day activities that you are able to perform prior to chemo. A wig works great while you're going through treatment, and that is always our recommendation is should you decide to wear a wig, it's a great option while you're going through treatment. But once the hair starts to regrow back, especially in hot California and sunny California, the wig can start to become very hot, itchy, and uncomfortable. And as much as a wig looks natural and looks great while you're going through treatment, it doesn't really give you the versatility of being able to like throw it up in a ponytail, go swimming, go to the sauna. That versatility you will have with the extensions as you transition back to day-to-day activity and performing in high strenuous activities. This is a collage of some of our clients that have had extensions as well as a CPR treatment and then wigs. So the top row showcases a post-cold capping client on your far left. She actually completed cold capping and she actually lives in New York. So we went to her in New York and she just needed some more density and length. She did have a good amount of retention in the crown of her head. So we just needed to add in some more density and length. CPR treatment on your far right, and then in the middle we've got post chemotherapy. So she just let her hair naturally shed. And then in the bottom row we've got clients who on the far right, that is actually her hair on the left side. That was prior to when it was cut, and then on the right, that is a custom wig that we made for her. So her hair, she is currently in treatment, undergoing treatment, and she is participating in the CPR program. In the center, we've got a client who also did cold capping, but is on immunotherapy, so she will continue to see some hair thinning, so we created a wig for her. And then on the far left is a client who also had a custom wig made. Insurance coverage. So we work closely with insurance providers in ensuring that we can get as much as our services covered. The steps to get insurance coverage is retrieving a prescription from your oncologist or healthcare provider for a cranial prosthesis, which is a medical term for head covering. We will take that prescription and work with our team. What we'll do is work closely with our team to best determine which treatment plan is more suitable for you, whether you are reaching out upon diagnosis, during treatment, or post-chemotherapy, which treatment plan we're going to go with. Upon completion of extensions or a wig fitting, our team will provide you with a medical receipt and work closely with you to submit a claim from insurance for reimbursement. Most of our clients who have private insurance plans are able to get anywhere between 60 to 100% back from insurance. And it is subjective from one person to the next, but generally speaking, Depending on the plan and their provider, we are able to get that about anywhere between 60 to 100% back. Any questions?
I had a quick question. With the extensions, how does all that work? Like, what is actually connecting those extensions to the root hair? And do you have to do any particular kind of care? Can you brush it like normal hair? Like, how does that work?
Yeah. So I didn't want to go into too many of the details and get very meticulous about the process, but thank you for your question, Alison. That's a big question for a lot of women and people. Extensions is uncharted territory for them. So understanding and navigating that and trying to best understand what methods it is we use is particularly important, especially because the biggest thing for us is promoting healthy hair growth. So we don't use any glues or any tapes in our extension methods. We use very fine microbeads as well as like a crocheting technique, depending on how thick or how fine the hair is, if there's any brittleness or dryness caused by chemotherapy. So just taking a look at the state of the hair and how it's growing in, if there's a chemo curl that has occurred, which sometimes happens, a change in texture caused by chemotherapy. So depending on that, our team takes a look at the length of the hair the client would like, as well as the current state of their hair to best determine which extension methods to use that will not cause any breakage or damage to the natural hair. And how we maintain the extensions is every 3 to 4 months, we see our clients because their hair continues to grow out, take out those extensions. It's a great time for them to see the progress of their hair growth, reassess if we need to change the treatment plan, and then reattach the extensions to the root of the hair. They can brush the hair like they normally would their natural hair. We provide all of our clients with an aftercare guide of how to maintain and take care of the extensions, but there isn't really anything that like any restrictions or any changes, but yeah, it just takes a little bit of time getting used to having extensions, but once you embody them and really feel like it's your own hair and part of your identity, that's when it becomes like a part of you.
This was a great presentation. I have a
Thank
question
you.
for you too, and partly you touched on it, because when chemotherapy regrowth occurs post-chemotherapy, the hair is often different. And you mentioned the chemo curl, which is a term I hadn't heard before. But you use different methods, it sounds like, for determining how to reattach the hair.
Correct.
So when you are looking at the beginning piece of it, so if any of us came in to see you today, is there a limit on how short the hair is to start with? So some of us have longer styles, but is there a length limit where you can't really do this for someone before chemotherapy?
So prior to treatment, upon completion of treatment, we require 1 inch of growth. Prior to treatment, it really is like if you have your hair cut at like a bob length, like right underneath, like at the chin line, we wouldn't necessarily recommend making a wig out of your own hair because we lose about 3 inches of growth when we're making the wig. So that wig actually may lose 3 inches, and at that length, it feels a little bit obvious. So if you have shorter hair, we typically recommend either preserving the hair at the root, so cutting it at the root, or just allowing the hair to naturally shed. Some of our clients, they're not quite ready to cut the hair at the root upon diagnosis of treatment to preserve their hair. So we offer 2 different cutting preservation methods. One is cutting the hair at the root, putting it into very small ponytails all over, which is kind of similar to the image that was displayed on that slide. Or for some of our clients that have more length and are able to retain and want to keep as much as their hair as possible until they've started treatment, is we recommend cutting it at like just 8 to 10 inches. That's all we would need. So again, to just reiterate, it is very subjective from one person to the next. And it just really depends on what's important to the client or patient. Some clients, what's important to them is they don't care if they don't have a wig while they're going through treatment, but they want to make sure that once they finish treatment, they have extensions and they can go back to that kind of normalcy upon completion. But for some of our other clients, it's really important for them because they aren't telling certain family members, or they're going to continue working, that they have a very natural wig while they're going through treatment. So it really is subjective on what's important to them while they're going through treatment. And based upon that, and really talking to our clients and learning more about them and their journey and what they're looking for, we're able to put together a personalized treatment plan for them that will best serve their needs.
I had a couple questions from the chat really quickly.
Yeah.
So one question was, you had mentioned private insurance can often be covered. They were asking, is Medicare insurance considered private? Do you work with Medicare?
Unfortunately, Medicare does not cover cranial prostheses, which is the medical head covering. So that is not something that Medicare covers. But if the client does have a supplemental plan, we can look at exploring the supplemental plan to see if it covers that.
Okay, perfect. And then you had also mentioned having a client from New York. How does it work with outside of SoCal? Do you guys operate outside of Southern California? Are those just exceptions? How does that?
Yeah, thank you also for that question. But yes, we do operate outside of California. We have clients from all across the nation as well as Canada. We offer in-home servicing for some of our clients for medical purposes or just logistics. They are not able to come to us here at our center in Los Angeles. So we offer in-home services to all of our clients, and we pretty much they go through a specific process to, scheduling that, but it is something, it's a viable option that we offer to all of our clients, and we have clients all over. We're constantly traveling to them. So that is an option that we are proud to offer to a lot of our clients. And of course, we welcome them if they're able to travel to us here, but we completely understand that sometimes just for medical purposes, they're not able to. So, yeah.
Got it. And then we had one more question, if you don't mind.
Yes. No, that's okay. Ask all the questions. I am a vessel for you.
So I'm sure it'll depend on the situation, but they were asking, what is your range of costs for different types of wigs?
For wigs.
Range?
So wigs, it ranges anywhere, and this is a very wide range, anywhere between $595 to $5,000. And that spans from hybrid wigs to the finest quality grade real human hair wigs for our clients that have recurring cancer and need something that'll give them more longevity. So a wig that gives them like 3 to 5 years of wear, that is definitely on the higher end. But it is subjective on the type of wig as well as the quality of the hair. And, making the wig out of your own hair is a lot more cost affordable. But that is the range for wigs. And to give you better pricing, I would definitely recommend reaching out. On the previous slide, I did input our contact information. So if you would have any questions about any specific wig or would like pricing, I'd be more than happy to walk you through what that would look like. So please reach out directly to us. And again, our pricing is not anything that's set. We are a small organization, and we are constantly doing our best to make our services more accessible to a lot of clients and patients without compromising the quality of our work. So, we do our best to try and work with insurance as well as clients' budgets to meet within their frameworks and still ensuring that we are upholding our quality. So reach out, and I'd be more than happy to provide you with more information in regards to pricing.
Perfect. Thank you so much.
Of course. Thank you.
Thank you, Hiba. This was a great presentation.
Thank you. Thank you for your time.
We're pleased to have you here, and their contact information is on the slide here. And our contact information for our monthly and previous health and wellness series, you can check the website out, and certainly call us if you need to see us.